Hello, good morning to my dear lecturer and my fellow friends. My name is Navin Thiruvan. Today I'm going to present about glaucoma. Okay, first let's see what is glaucoma. Okay, glaucoma is a group of disorder characterized by an abnormally high intraocular pressure. IOP. Optic nerve dystrophy means weakness and peripheral visual field loss, which is tunnel vision. It is a symptomatic condition of the eye where the IOP is more than the normal, which is above 25 mm mercury. Untreated of glaucoma leads to permanent damage of the optic nerve and resultant visual field loss, which can progress to blindness. Glaucoma is an eye disease where the eye's optic nerve is damaged. It is one of the leading causes of blindness. Eye anatomy. Okay, the optic nerve is a bundle of nerve fibers. It carries visual information from the retina to the brain. The eye has an internal fluid circulation system. Fluid is produced at the base of the iris. The fluid flows through the pupil to the front of the iris. The fluid exits the eye at the angle between the iris and the cornea, where it drains through a spongy meshwork. So over here, I could include the picture of the cross section of the eyes, so you guys can see that. Okay. Okay, next we see the causes and the risk factors of glaucoma. So first is genetics, which means the family history of glaucoma. Let's say if a family, if our family have glaucoma, means it can be carried forward to the following generations. Okay, and then next is aging. The older a person gets, the more health problems they will face. So including this glaucoma. Okay, so ocular hypertension. It is a condition where the pressure in your eyes or IOP is too high. Continuous high pressure within the eye can eventually damage the optic nerve and lead to glaucoma or permanent vision loss. Severe myopia. It is associated with an increased risk of pathological ocular complications and may lead to blinding disorder like glaucoma. So next is eye trauma. It is the most commonly caused by blunt trauma, which is an injury that does not penetrate the eye, such as a blow to the head or an injury directly to the eye. This can lead to an increase in the eye pressure, which can damage the optic nerve. Ocular surgery. It can cause a change in the eye's pressure. Sharp increases the eye pressure are called pressure spikes and sometimes occur in patients after cataract surgery. Often these pressure spikes are short-term and can be treated with medicines. Okay. So next is migraine, which is prolonged to increased pressure can lead to visual loss if not corrected. Okay, so black ethnicity. African Americans are also more likely to develop glaucoma at a younger age and suffer blindness from the disease. The genetic causes underlying glaucoma remain unclear, but these ethnic disparities in the risk of developing glaucoma suggest a genetic basis that is ethnicity specific. Next is prolonged use of local or systemic corticosteroids. So long-term use of topical or systemic and systemic steroids produce secondary open-angle glaucoma similar to chronic simple glaucoma. The increased intraocular pressure caused by prolonged steroid therapy is reversible, but the damage produced by it is irreversible. So next is diabetes and glaucoma. Let's see what's happened. Diabetes retinopathy, which is a complication of diabetes and the most common form of diabetic eye disease, can increase the risk of glaucoma. Diabetic retinopathy usually affects people who have had diabetes for a long time. With diabetic retinopathy, changes in the glucose level can cause the blood vessels in the retina to weaken and become damaged. These can eventually lead to glaucoma. The leading theory is that when the blood vessel in the retina becomes damaged, It can cause abnormal blood vessel to grow in the eyes, known as neurovascular glaucoma. This blood vessel can block the eye's natural drainage system. So the drainage system will be like blocked. So there won't be a proper drainage from the eyes. Okay, so when this happen, it can cause the eye pressure to increase, which can lead to glaucoma. Okay, so pathophysiology of glaucoma, let's see. Internal ocular pressure is a function of production of liquid aqueous humor by the ciliary processes of the eye and its drainage through the trabecular meshwork. So aqueous humor is produced by the ciliary body and flow into the posterior chamber behind the iris. The trabecular meshwork filters the aqueous humor into Schlemm's canal, which is picked up by the aspicularal vessels and mixed with the blood. So here is the picture where I show the trabecular meshwork at. So classification of glaucoma. Congenital glaucoma. Under congenital glaucoma, there is true congenital glaucoma, infantile glaucoma, juvenile glaucoma. After that, we have acquired glaucoma, where there is primary glaucoma and secondary glaucoma. So first we see the congenital glaucoma. It is a rare disease, occurs when a congenital defects in the angle of the anterior chamber obstructs the outflow of aqueous humor. If it is left untreated, it can cause damage to the optic nerve and blindness. In most cases, surgery is required. So under the congenital glaucoma, there is true congenital glaucoma, infantile glaucoma, juvenile glaucoma. So first we see the true congenital glaucoma. It is labeled when IOP is raised during intrauterine life and child is born with ocular enlargement. Its occurrence is about 40% of the case. It's like quite high also. Okay, so next is infantile glaucoma. It is labeled when the disease manifests prior to the child's third birthday. It occurs in about 50% of the cases, which is higher than the true congenital glaucoma. So juvenile glaucoma, it is labeled in the rest of 10% of the cases who develop pressurizers between 3 to 6 years of life. So next is acquired glaucoma, where we have primary and secondary. So under primary, we have primary open angle glaucoma and primary angle closure glaucoma. So first we see primary open angle glaucoma, which is primary. It is the most common form of glaucoma. Okay, so it occurs when the fluid drainage is poor and fluid buildup in the eye and the internal eye pressure goes up. This increased pressure can cause damage to the optic nerve and vision loss. The exact mechanism of damage is still unknown. The symptoms are it develops gradually and painlessly and has no initial symptoms. Vision is normal in the early stages. If untreated, peripheral or side vision will be slowly lost. Tunnel vision is which is defective sight in which object cannot be properly seen if not close to the center of the field of view. Eventually, all vision may be lost. So here is the picture where we can see the tunnel vision, how it looks. Okay, it's focused in the middle only. The side part of the view will be blurred. So primary angle closure glaucoma. This type of glaucoma is an emergency situation. It occurs when the iris itself blocks the drainage angle and results in a sudden increase in pressure. Symptoms include severe eye pain, nausea, eye redness, and very blurred vision. Immediate treatment is required. Okay. So next is secondary glaucoma. Glaucoma can develop as a complication from other conditions including eye injuries, diabetes, steroid use. Low tension glaucoma or normal tension glaucoma is not as common. In these cases, the eye pressure is in the normal range, but the optic nerve still gets damaged. The exact mechanism of damage is still unknown. So let's see diagnostics evaluations. Regular eye examinations by an optometrist or ophthalmologist are vital to detecting glaucoma. A number of tests are performed. A patient's medical history, family history, and background are important to determine the presence of risk factors. So glaucoma test, it is you see on the left there is a special microscope called a slit lamp is used to examine the structure of the eyes. On the below side, a gonioscopy lens may be used to view the drainage angle. So slit lamp exam, how it is done. Let's see. Once patient in the examination chair, the doctor will place an instrument in front of the patient on which the rest chin and forehead. This helps steady head for the exam. Doctor may put drops in the eyes to make any abnormalities on the surface of cornea more visible. The drops contain a yellow dye called fluorescein which will wash away the tears. Additional drops may also be put in the eyes to allow pupils to dilate or get bigger. The doctor will use a low-powered microscope along with a slit lamp, which is a high-intensity light. They will look closely at the eyes. The slit lamp has different filters to get different views of the eyes. Some doctors' offices may have devices that capture digital image to track changes in the eyes over time. During the test, the doctor will examine all areas of the eyes, including the eyelids, conjunctiva, iris, lens, sclera, cornea, retina, and also optic nerve. So next is tonometry. Eye pressure is measured with an instrument called a tonometry. It is the procedure eye care professionals perform to determine the intraocular pressure, the fluid pressure inside the eye. It is an important test in the evaluation of patient at risk from glaucoma. Normal pressure range is 12 millimeter mercury to 22 millimeter mercury. So ophthalmoscopy, eye drops may be placed in the eyes to dilate the pupil. Special magnifying lenses are used to examine the retina and optic nerve for damage. So as you guys can see, that is the device where we can magnify the eyes, okay, to examine the retina and optic nerve. So on the right hand side, we can see the healthy optic nerve and the optic nerve in the eyes with glaucoma. Okay, that is a difference. So next is color fundus photography. Fundus camera to record colors images of the condition of the interior surface of the eye in order to document the presence of the disorder and monitor their change over the time. Okay, so a fundus camera or retinal camera is a specialized low power microscope with an attached camera designed to photograph the interior surface of the eye, including the retina, retinal vasculature, optic disc, macula, and posterior pole. So medical management. If you see medical management, there is beta-adrenergic blockers, where we use timolol and betaxolol, which are used to decrease the aqueous humor production. Next is cholinergic myotics. The example of drugs are pilocarpine and carbachol, which is used to reduce IOP by facilitating the outflow of the aqueous humor. Next is carbonic anhydrase inhibitor. The example of the drugs are dorzolamide and metazolamide or acetazolamide, which is used to decrease the formation and secretion of aqueous humor. Next is prostaglandin analogs. The example of the drugs are elatonopros, which is used to reduce IOP by increasing uvascular outflow. Next, we can see surgical management. For surgical management, we have argon laser trabeculoplasty. It may be used to treat open-angle glaucoma. In this, thermal argon laser burns are applied to the inner surface of the trabecular meshwork to open the intratrabecular spaces and widen the canal of the sclem, thereby increasing the outflow of the aqueous humor and decreasing IOP, the internal ocular pressure. pressure. So next is laser iridotomy. An opening is made by the laser beam in the iris to eliminate the pupillary block. It relieves pressure and preserves vision by promoting outflow of the aqueous humor. Next is cyclocryotherapy. Application of a freezing probe to the sclera over the ciliary body that destroys some of the ciliary processes results in reduction of the amount of aqueous humor produced. Cyclodialysis through a small incision means the cut in the sclera. A spatula type instrument is passed into the anterior chamber, creating an opening in the angle. Filtering procedures. For chronic glaucoma, filtering procedures are used to create an opening or fistula in the trabecular meshwork to drain aqueous humor. Next is trabeculotomy. A partial thickness incision is made in the sclera and further section of sclera is removed to produce an opening for aqueous humor outflow under the conjunctiva, creating a filtering bleb. Sclerotomy. A partial thickness incision is made in the sclera and one or more openings are made with a punch. The top flap of sclera is closed over the punched holes. So that's all from me from this topic. Thank you so much.